You know that sound?
Yeah.
Like when your dog's really, really deep asleep, that kind of snore. Or maybe your cat does that little snort, trying to look all regal, but just sounds a bit, well, stuffy?
Yeah, we often just brush them off, don't we? I think they're just, cute little quirks.
Exactly. Little personality sounds. But sometimes those noises aren't just background. They could actually be signals.
Signals from their body telling you something important about their breathing.
Right. And how our pets breathe, that's such a huge indicator of their health.
It really is. So abnormally loud breathing sounds, they're not just random noise. They can mean something significant is happening in their airway.
You mean the path air takes, like, from the nose down to the lungs?
Precisely. That whole system.
And that's exactly what we're getting into today. We've been looking through quite a bit of veterinary research.
Clinical guides, articles from specialists, all focusing on these noisy breathing sounds in dogs and cats.
Yeah, and our mission, really, is to help you understand what these different sounds might mean.
Where they're coming from in the respiratory system.
And critically, when they cross that line from just being a weird noise to a potential warning sign, something needing urgent attention.
And in this whole story of noisy breathing, the research points to two main players, two key sounds right away, Stertor and Stridor.
Stertor and Stridor. Okay. They sound kind of similar if you just say them like that.
They do, but they're actually fundamentally different noises. And each one points to potential issues in different parts of the upper airway.
Okay, like codes the body is sending.
Sort of, yeah. Different signals for different locations.
All right, let's unpack that then. Stertor first. What's the sound like? The material describes it as low-pitched.
That's right. Low-pitched. Think snoring, maybe a rattling sound, sometimes even gurgling.
Snoring, rattling, gurgling.
Yeah.
Low pitch. And where does that usually come from?
Typically from the front part of the upper airway. So the nasal passages or the pharynx, which is the back of the throat near the soft palate.
Ah, the soft palate area.
Yeah, and it's usually caused by vibration. Soft tissues, maybe a bit floppy, vibrating as air rushes past them.
Got it. So low pitch, snoring, gurgling sound from the front nose or throat floppy tissue vibrating.
Exactly.
They often call it the bulldog sound, right?
Hmm.
Which makes sense thinking about bulldogs, pugs, Frenchies.
Precisely. It's very common in those brachycephalic breeds, and you might hear it when they breathe in or out, or sometimes both ways.
Okay. And the research says Stertor on its own, like without other signs of distress.
Yeah.
It isn't always a dire emergency.
Not always immediately, no. It can indicate a partial blockage or turbulent flow, but it might be more of a chronic thing for some pets.
Okay. So that's Stertor, low front floppy tissue. What about Stridor then? How's that different?
Stridor is very distinct and, frankly, often more concerning. This one is high-pitched.
High-pitched. Okay, definitely different.
Yeah, think more like a harsh wheeze, maybe a whistling sound, sometimes even gasping, especially when they breathe in.
Wheezing or whistling,
Mm-hmm.
and usually in the in-breath.
Yes, the pitch is the first big clue, and its origin, usually further back in the airway.
Further back than the nose and throat.
Right. We're talking the larynx, the voice box, or the part of the trachea, the windpipe, that's in the neck.
Okay, voice box or windpipe.
And this sound comes from air vibrating more relatively rigid tissues. It usually means there's a more significant narrowing of that airway tube further down.
Ah, okay. So, Stridor, high-pitched, further back, voice box windpipe, narrowed, stiffer passage, and mostly heard breathing in.
Exactly. Inspiratory stridor, that high sound on the inhale, is the most common way it presents. And it's a major red flag.
A red flag. Why more so than Stridor?
Well, here's where it gets really crucial for anyone listening. Stridor is generally seen as more serious, potentially even life-threatening, compared to Stridor.
Okay.
A continuous Stridor, or a really loud one that warrants immediate veterinary attention. It points to a more significant blockage of the main airway, that critical tube leading right down to the lungs.
Wow. Okay. So, for us listening, the key is pitch. That tells us roughly where the problem is.
Pitch implies location, absolutely. Low-pitched snoring, gurgling from the front is Stertor.
Nasal passages, throat area.
Right, and high-pitched whistling or wheezing, especially breathing in, from further back voice box, windpipe, that's Stridor.
And Stridor is the bigger emergency signal.
Generally, yes. Just listening carefully, that's the first step. Pitch, low versus high. That suggests location, which gives you a sense of potential severity.
And you mentioned effort. Like, animals with Stridor might look like they're working harder to breathe in.
Yes, often there's a noticeable effort on inhalation. It looks like they're struggling to pull air through a tight opening.
That makes sense, like trying to breathe through a pinched straw.
Exactly.
And the research talks about how this happens, the mechanism. Airway obstruction causes turbulence.
Right. Think of smooth airflow suddenly hitting a bottleneck or flapping tissue. It gets chaotic, turbulent.
Okay.
And as that blockage gets worse, or if the pet starts breathing faster or harder, say, if they get stressed or hot, that airflow speeds up even more. This makes the tissue vibrate more violently or whistle through the narrowing more loudly. The sound gets worse.
And the material describes this like dangerous cycle. It's hard to breathe, so they try harder.
Right, using more muscles, pulling harder.
But that increased effort actually makes things worse.
It can, yes. It increases turbulence. It can also cause inflammation and swelling in the tissues right around the blockage.
Making the opening even smaller.
Precisely. Which, of course, makes them work even harder to breathe. It's a vicious cycle.
A positive feedback loop, a dangerous one.
A really dangerous one. And the sources consistently mention that obesity makes this much worse.
How so?
It adds to the overall respiratory effort needed and contributes extra tissue bulk in and around the airway, potentially narrowing it further.
Okay, that's important. So let's talk causes. What are the common reasons for these sounds? Starting with Stertor again, that low-pitched front of the airway sound. What's the big one?
The major one, especially in those flat-faced breeds we mentioned, is Brachycephalic obstructive airway syndrome, BO.
OAS.
Right.
Bulldogs, pugs, Frenchies, boxers, Shih Tzus, even some cats, like Persians.
Yep. And BOAS isn't just one single problem. It's usually a combination of anatomical issues they're born with.
Like what?
Things like stenotic nares, really narrow nostrils that don't open well,
Okay.
an elongated, soft palate that flap the back roof of the mouth is too long, hangs down into the airway.
Ah, that floppy tissue we talked about.
Exactly. That's a primary cause of the stertornoias as it vibrates. They can also have other issues like abnormal tissue folds inside the nose or even problems further back near the voice box if it's severe.
So BOAS explains the bulldog sound perfectly. What else might cause Stertor?
Well, pretty much anything else that physically blocks the nasal passages or the back of the throat.
Like growths.
Yes. Things like polyps. They're benign but can get big, especially in cats. Sometimes they grow from the ear down into the throat.
Oh, wow.
Or, more worryingly, neoplasia cancers.
Okay, masses. What about infections? Or just inflammation?
Definitely. Chronic inflammation in the nose or sinuses, like rhinitis or sinusitis, severe dental disease if an infection spreads up into the nasal cavity,
Right.
or even something simpler but still a problem, like a foreign body stuck up there, piece of grass, a twig.
Lodged up the nose. Ouch. Okay, and what about that weird thing some dogs do, that sudden snorting inwards?
Reverse sneezing, that paroxysmal snorting. Often that's just an irritation reflex, nothing serious. But if it becomes really frequent or severe or changes pattern, a vet might want to look closer.
For what?
Underlying causes like mild inflammation, maybe an allergy, even a tiny foreign object way back there.
Interesting. Any other causes for Stertor?
Yeah, being overweight, like we mentioned, certain hormonal things like hypothyroidism, low thyroid function, or even trauma, like an injury to the face or nose.
Okay. Lots of possibilities for Stertor. Now, switching to Stridor, the high-pitched sound from the voice box or windpipe area, what are the main culprits there?
A really common one, especially in older, larger breed, dogs think Labradors, golden retrievers, Newfies maybe,
Yeah?
is laryngeal paralysis,
Huh?
often called LARPAR.
Laryngeal paralysis. What happens there?
Basically, the cartilages in the voice box, the larynx, they're supposed to pull open wide when the dog breathes in.
To let air through.
Exactly. But with LARPAR, they don't open properly, they stay partially closed, or just don't move effectively.
So the airway stays narrowed, causing that high-pitched turbulent sound when they inhale.
Precisely. It's like trying to suck air through that pinched straw again. It often causes a harsh, raspy stridor.
Any other signs with that?
Yeah, owners often notice a change in the dog's bark. It might sound hoarse or weaker. It tends to develop as dogs get older, but some can be born with a version of it.
Okay, LARPAR. What else causes Stridor?
Another condition with a very distinct sound, often associated with Stridor, is tracheal collapse.
The goose honk cough.
That's the one.
Yeah.
Very common in small and toy breeds, Yorkies, Pomeranians, Chihuahuas. The cartilage rings that hold the windpipe open get weak and flatten out.
Right?
And if the collapse happens in the part of the windpipe up in the neck, it can definitely cause inspiratory stridor, that high-pitched sound on breathing in, especially when they get excited or pull on a collar.
Pulling on a collar. Okay.
Yeah.
Makes sense. What about just swelling in the voice box?
Absolutely. Inflammation or swelling laryngeal edema, this can happen from severe allergic reactions, really bad upper respiratory infections,
Okay.
or even irritation, say, from having a breathing tube placed during surgery. This kind of swelling can happen fast and be life-threatening. It's an emergency.
A definite emergency. Masses, again, can they block things further back too?
Correct. Growths or cancers in the larynx or the trachea are definitely potential causes of stridor.
And you mentioned BOAS earlier, mainly for Stridor, but can it cause Stridor too?
Yes, interestingly, some of the more severe components of BOAS can lead to stridor.
Wow, like that elongated soft palate.
Exactly. If it's really long and floppy, doesn't just vibrate low down, it can actually get sucked into the opening of the larynx when they breathe in, blocking it partially.
Wow.
And remember those everted laryngeal saccules?
Hmm.
Little tissue pockets near the voice box that get sucked in because of the increased effort from BOAS?
Yeah.
Those can directly obstruct the laryngeal opening too. And the most severe stage is laryngeal collapse, where the voice box cartilages themselves actually break down due to chronic strain. That causes severe, persistent stridor and often leads to crisis.
So BOAS can start with that lower Stridor sound, but progress to the higher Stridor sound if things get worse or affect the larynx.
That's right. Other things mentioned that can cause stridor include foreign bodies actually stuck in the larynx or trachea, a congenitally narrow windpipe, which some flat-faced breeds can have, or trauma to the neck area.
Okay, so we've got Stertor and Stridor defined, where they come from, and a whole list of potential causes: anatomical stuff, infections, masses, trauma.
But based on the research, the most critical question for anyone listening has to be, when is this an emergency?
This is absolutely the key takeaway. While mild, occasional Stertor might be chronic, any pet showing significant Stertor or Stridor needs careful assessment.
Especially if it's continuous or loud.
Yes, or accompanied by other worrying signs. That should absolutely be treated as an emergency.
And what are those other worrying signs we need to look for?
Increased respiratory effort. That's a major one.
What does that look like?
You might see their sides really heaving, their chest moving in a very exaggerated way,
Yeah.
sometimes even paradoxical breathing where the chest wall actually sucks in when they try to breathe in instead of expanding out.
Paradoxical breathing. Wow, that sounds really scary to see.
It is. It's very distressing. Also, watch for exercise intolerance, like they suddenly can't handle their usual walk or it gets worse very quickly.
Any bluish or purplish color to their gums or tongue, that's cyanosis, a sign of low oxygen.
Bluish gums, got it.
Overheating. Because they're working so hard to breathe, they can get dangerously hot.
Right, that dangerous cycle again.
Exactly. And the worst case scenario, obviously, is collapse.
So, increased effort, paradoxical breathing, can't exercise, blue gums, overheating, collapse. Any of those with a noisy breathing.
Any of those accompanying significant stertor or especially stridor, that pet needs immediate veterinary attention. Don't wait.
Call the vet or emergency clinic, let them know you're coming.
Absolutely. Call on the way.
Okay, so someone gets their pet to the vet in that kind of emergency state. What happens then? What are the priorities?
The immediate goals, based on all the emergency protocols, are get oxygen into them, minimize their stress, and quickly reduce any inflammation or swelling if that seems to be part of it.
Oxygen first. How do they do that?
Often with a face mask or putting them in a special oxygen cage or tent, then sedation is usually crucial.
Sedation, why?
To calm them down. Break that cycle of panicked breathing, making the obstruction worse. Vets use specific sedatives that are safer for pets with breathing issues, helping them relax and breathe a bit easier.
Okay.
They need a quiet, cool environment. Absolutely nothing that could stress them or make them struggle.
Avoid excitement, avoid restraint if possible.
Definitely. Minimal handling unless essential. If they are overheated, cooling measures are started wetting them down, fans, maybe cool IV fluids.
Right.
And often, a fast-acting steroid injection is given intravenously. That's to quickly knock down any inflammation and swelling in the airway tissues, if that's suspected.
Steroids for swelling. And the ultimate goal right then is to secure the airway, make sure air can get in.
That's the priority. The vet needs to assess if they can intubate carefully, pass a breathing tube down the windpipe, past the obstruction.
But what if the blockage is too severe, like that laryngeal collapse you mentioned?
Yeah, the research points out that sometimes getting a tube past a severe obstruction might be impossible.
Then what?
In those really dire situations, an emergency tracheostomy might be the only option to save their life.
Surgically creating an opening directly into the windpipe lower down.
Yes, a temporary hole in the neck into the trachea to bypass the upper airway blockage entirely and get oxygen into the lungs. Vets handling these emergencies need to be prepared for that possibility.
Wow. Okay, so stabilize first in the emergency,
Yes.
then figure out the exact cause.
Precisely. Once the pet is stable, breathing better, then the detective work begins. A systematic diagnostic workup to pinpoint the underlying reason for the noise.
Which involves?
Getting a really thorough history from you, the owner. When did it start? What makes it worse? Any other signs like coughing, voice changes, then a very careful physical exam, listening closely over different parts of the airway, nose, throat, larynx area, the trachea and the neck, trying to localize where that sound is loudest.
Does where it's loudest really help narrow it down?
It can, significantly. The research suggests, for example, if the sound continues even when the pet opens their mouth wide, you can probably rule out the nasal passages being the main source.
Oh, interesting.
And if you report a change in their bark or meow, the larynx, the voice box, becomes a prime suspect.
Makes sense. They also look inside the mouth.
Yes, an oral exam is needed, often done under light sedation so the vet can get a good look back there without causing stress.
What about pictures? X-rays? CT scans?
Very important tools. Standard x-rays of the head and neck might show something obvious, like a foreign body or certain masses. Maybe an elongated soft palate, though x-rays aren't always great for seeing how things like the voice box move.
Right.
Chest x-rays are also really crucial. Check for problems like aspiration pneumonia, which can happen with laryngeal issues, or see if other lung or heart conditions could be contributing.
Okay.
There's also a special type of moving x-ray called fluoroscopy that lets the vet watch the windpipe move as the pet breathes. That's useful for diagnosing tracheal collapse.
Fluoroscopy.
Yeah.
And for even more detail.
For really detailed images of the whole upper airway, nose, throat, larynx, trachea, a CT scan is often considered the gold standard. It gives these fantastic cross-sectional views.
Okay, what about actually looking inside those areas directly?
That's where endoscopy comes in, using tiny cameras.
Like laryngoscopy.
Exactly. Laryngoscopy uses a scope to look directly at the larynx, the voice box, usually done under very light anesthesia or deep sedation, just enough so the vet can see how the cartilages move when the pet tries to breathe in.
So that's how they diagnose laryngeal paralysis, for sure.
It's the definitive test for LARPAR, yes, and for seeing many other voice box problems.
And for the nose and throat.
Similar techniques. Rhinoscopy uses a scope to look inside the nasal passages, and nasopharyngoscopy looks at the back of the throat area. Key for investigating Stertor causes like polyps, foreign bodies, or growths up there.
And I guess biopsies if they see something abnormal. Maybe blood tests.
Absolutely. If they see abnormal tissue or a mass, biopsies are essential to figure out if it's inflammation, a benign polyp, or cancer. Blood work gives a picture of overall health, rules out systemic things like thyroid issues that could play a role.
Okay, so they figure out the cause. What's the typical treatment? Is it always surgery?
Not always, but very often for the anatomical problems, the things physically blocking the airway.
So when is medical management okay?
The research suggests medical treatment alone is usually only appropriate if the root cause is something like straightforward inflammation, maybe an infection, or temporary swelling.
Right.
So anti-inflammatory drugs like steroids might be used for that swelling or inflammation. Antibiotics if there's a bacterial infection, but for mechanical problems.
Like the physical blockages, the floppy palate, the collapsed windpipe, the paralyzed voice box.
Exactly. Those generally can't be fixed with medication alone. They need a physical solution.
So for those common issues like BOAS, laryngeal paralysis, tracheal collapse, surgery is usually the answer.
Yes, typically. For BOAS, surgery might involve widening the nostrils, shortening that elongated soft palate, removing those averted saccules near the voice box, fixing the anatomical issues.
Okay.
For severe laryngeal collapse or for laryngeal paralysis where the voice box won't open, there's a common surgery often called a tieback.
A tieback?
Yeah, it aims to permanently suture one side of the larynx open to create a wider airway.
Ah, to improve airflow.
Right. For tracheal collapse, treatment might involve medication, weight loss, using harnesses instead of collars. But in severe cases, they might surgically implant stents inside the trachea to hold it open.
Stents, okay.
Yeah,
And obviously growths or foreign bodies just need to be removed.
correct. Sometimes that can be done with the endoscope. Sometimes it requires more open surgery.
And the sources mentioned anesthesia itself carries extra risk for these guys.
Extremely high risk. Special care is absolutely vital when sedating or anesthetizing any animal with a known upper airway issue. The risk is the airway could collapse further under sedation, or they could struggle to breathe on their own during recovery. The whole veterinary team needs to be hyper-prepared for potential airway emergencies during and after any procedure.
And even after successful surgery, there can be swelling.
Yes, for several days, maybe even a week or so. So really close monitoring after the operation is crucial.
Makes sense. So beyond the specific vet treatments, what about general things you can do at home? What helps a pet with these noisy breathing issues?
The research really emphasizes a few simple but incredibly important things. Weight management is huge if the pet is overweight.
Because extra weight puts pressure on the airway.
Exactly. It makes them work harder to breathe. So weight loss helps tremendously.
Okay. What else?
Avoiding strenuous exercise, especially when it's hot or humid out,
Right.
and minimizing extreme excitement. Both those things dramatically increase how much oxygen they need and can trigger a respiratory crisis if their airway is already compromised.
Okay. Keep things calm and cool.
And consistently using a harness instead of a neck collar. Strongly advised for dogs, particularly those prone to tracheal collapse or laryngeal problems. Avoids any direct pressure on the windpipe.
Harness, not a collar. Got it. Simple, but important. What about the overall outlook? The prognosis for pets with these conditions?
It really varies a lot. Depends on the specific cause, how severe it is, and how quickly it's diagnosed and treated.
So some do well.
Oh, yeah. Things like simple polyps removed or BOAS components corrected surgically early on, often a good to excellent prognosis. Big improvement in quality of life.
That's good to hear. What about things like LARPAR or tracheal collapse?
For LARPAR managed with a tieback or tracheal collapse with stents, the prognosis is often described as fair to guarded. Meaning quality of life can improve significantly, which is great, but there are potential long-term complications to be aware of, like there's an increased risk of aspiration pneumonia after a tieback surgery.
Okay. And I guess aggressive cancers or really advanced irreversible conditions?
Yeah.
The outlook isn't as good?
Unfortunately, no. For those, the prognosis is often poorer, and sometimes the focus shifts more towards palliative care, just keeping the pet as comfortable as possible.
Okay. So wrapping this up, the core message from this deep dive seems really clear. Those sounds Stertor trode. Stridor, they aren't just random.
Not at all. They're specific signals. Stertor, low-pitched from the front nose, throat. Stridor, high-pitched from further back larynx, trachea.
And recognizing that difference, especially the high-pitched stridor, and knowing those emergency signs, the increased effort, blue gums, collapse, that's absolutely vital.
It's critical for getting your pet urgent help when they truly need it.
And it sounds like many of the underlying causes aren't minor things. They need proper investigation.
They really do. Often requiring specific diagnostics like imaging, CT scans, endoscopy to figure out exactly what's wrong. And frequently, surgery is needed to actually fix the physical problem and help them breathe properly.
Which brings it back to you, listening. You're the one who sees your pet every day. You're their advocate.
Absolutely. Understanding these sounds, knowing the difference, recognizing when is potentially life-threatening and needs that immediate vet visit. That's huge.
And doing those simple preventative things,
Yeah.
managing weight, avoiding heat and overexcitement, using a harness that can make such a difference too.
It really empowers you to spot when something's wrong and act decisively for their well-being, their comfort, their quality of life.
So the question to leave you with is, next time you hear a strange breathing sound from your furry friend, will you listen a bit differently now?
Equipped with the knowledge of what their airway might actually be trying to tell you?